Well, we are looking at imaging biomarkers in the dementia with Lewy bodies. Dementia with Lewy bodies is a very complex disease. We see many imaging changes in these patients, and we would like to understand how these imaging changes occur in the brains of patients with Lewy body dementia, because imaging can help us diagnose the disease earlier and perhaps identify patients who can respond to certain therapies better than others, and therefore we follow dementia with Lewy body patients with imaging biomarkers.
I saw my first 3 patients with Lewy body dementia as a resident about 20 years ago. And it was clear they had a cognitive syndrome with some motor component, some sleep component, but this wasn't part of my training. And so it's just one of those things where I happened to see several over a short period of time, and I've been interested ever since. So complicated disorder, it's a bit cliche-ish, but every patient is different, and it really is true. The rewarding aspect is there's a lot can be done symptomatically, whether it's drug and non-drug therapy, so it's a enjoyable, rewarding group of patients to participate in their care. The clinical and the imaging phenotyping is about as deep as can be done. A lot of motor component, sleep component, cognitive, neuropsychiatric, to some extent autonomic component. So on the clinical side, and very detailed imaging on the imaging side, plus the biofluid collection. It's about as rich of data on these individuals as one could probably get. Prognostication is important, so we're asked often, can you help me now? What can you look into the future and give me some sense of what to expect? And clearly, imaging can help us in those regards. Also, as a clinician, you want to be aggressive with every patient you see, but you have a sense based on some imaging markers where the therapies may be more beneficial than in other individuals. For example, if a lot of atrophy already exists on some of the imaging, you're a bit more guarded. And if you don't reach a lot of benefit in someone who have essentially a normal MRI scan, something's not quite right, and ramps up your aggressiveness a bit more. I think we'll be busy for many, many years. First, to map out what actually happens in those with Lewy body dementia. Then, once we get a good sense of the clinical and biomarker and neuroimaging features, step back. What about the more prodromal features, mild cognitive impairment, preceding DLB, and then years even before, most commonly REM sleep behavior disorder, but there are other prodromal features that one with relatively high predictability will develop into DLB. So if we can get to a mode of early diagnosis, prodromal diagnosis, intervene, and really impact delaying the onset or preventing DLB features altogether, that's where we want to be.